In New South Wales, there's been another big jump in hospitalisations in the past day. 520 people are in hospital, so that's up from 458 yesterday, so 63 more patients in hospital. Yesterday, there was a jump of 70 new patients on the day before, and 55 people are in intensive care, so that is gradually increasing as well. Today, in terms of case numbers, 6,324, so that continues that increasing trend we've seen, although over the last 3 days it's been stuck at about that level. But yeah, those cases are still skyrocketing when you can compare that to what's happened over the last couple of weeks. And that number today is from 97,000 tests. That's significantly down from 140,000 a few days ago. There have been 3 deaths in the latest reporting period. Reporter Sophie Wainwright joins us now from Sydney. Sophie, what can you tell us about this first reported Omicron death for New South Wales?
Well, it's a man in his 80s from Western Sydney who died at Westmead Hospital. He was a resident at Uniting Lillian Wells Aged Care Centre at North Parramatta, where he actually acquired the infection. He received 2 doses of the COVID vaccine, but also had underlying health conditions. A spokesperson for Health Minister Brad Hazzard says it's believed the bulk of cases in ICU are Delta, though genome sequencing is occurring over the next week to confirm. There's also been criticism about Mr Hazzard's comments made yesterday relating to the fact that everyone is going to be infected with the virus. Here's what Opposition Health spokesperson Ryan Park had to say.
The people of New South Wales expect leadership, and that's not what they're getting right now. Putting your hands up and saying everyone's going to get Omicron is not good enough. What we need the government to outline is what the plan are for our hospitals, what the plan is to increase testing clinics, and what the plan is to make sure our healthcare workforce can go through this period and have the resources and support they need. If you need to get Commonwealth support, do so now, do it early, and make sure that we can get through this difficult period in a sensible and practical way.
And Sophie, what's happening with restrictions in New South Wales today?
Well, Joe, compulsory QR check-ins were scrapped for lower risk settings such as cafes and retail earlier this month, but that's being reinstated today, though in a more limited capacity. So if you're going to a major shopping centre, for instance, you won't expect to have to check into each individual store that you step foot into. Also, the change today is 1 person per 2 square metre rules for indoor hospitality settings, and both of these changes are expected to be in place for at least a month.
Okay, Sophie Wainwright reporting there from Sydney.